Hello everyone, you're welcome to today's prenatal class, and today we'll be focusing on serious problems in pregnancy. Remember the last class we examined minor disorders in pregnancy. So today we'll just be focusing on the serious problems one could encounter in pregnancy. Okay, so please relax. You can get yourself a bottle of water as usual and stay connected, active attention to this class. So I remain Mercy Shittu, one of the midwives working here, of course, at the Reddington Multi-Specialist Hospital, Victoria Island. So let us start. Okay, so serious disorders in pregnancy, we could have what we call high blood pressure and pre-eclampsia. We could have placenta previa, we could have visa previa. So I'll take them one after the other. Okay, so I'll start with high blood pressure and pre-eclampsia. So during pregnancy, anytime you come in for your antenatal checks, so your midwife would check your blood pressure at every antenatal appointment. This is because a rise in blood pressure can be the first sign of a condition we call pre-eclampsia, and pre-eclampsia is also called pregnancy-induced hypertension or pre-eclamptic toxemia. So this thing usually runs in families and it affects, let's say, 10% of pregnancies. So also your urine will be checked for protein at every visit. So you see, when you come in, we ask you, please ma, this is a container for urine, and we check for the presence of protein in your urine. And the reason why we are checking is because the presence of protein in urine could indicate pre-eclampsia. So what are the symptoms of preeclampsia and high blood pressure in pregnancy? The first one is very bad headaches, which won't go away even with your normal painkillers. So there could be problems with vision, such as blood visions or light flashing before the eyes. There could be bad pain just below the ribs. There could be vomiting. There could be sudden swelling of the face, of the hands and the feet. However, you could have severe preeclampsia without any symptoms at all. It is possible. But majorly, the three cardinal signs of preeclampsia is high blood pressure, protein in urine, and excessive edema or weight gain in pregnancy. So although most cases of this preeclampsia, they are mild and at times they do not cause any trouble, but it could be serious for both baby and the mother, because it could cause the mother to throw fits, and this is what we call eclamptic fits, and also this also affects the baby's growth. This condition is life-threatening if it is left untreated. Okay, so that is why your routine antenatal checks are so crucial. You cannot afford to miss any of your routine antenatal checks. So preeclampsia usually happens towards the end of pregnancy, but it may happen earlier. It can also happen after birth. It is likely to be more severe if it starts earlier in pregnancy. And treatment may start with you resting at home, but some women may need to present to the hospital for admission and also for medications that will help them to lower the increased blood pressure. Occasionally, preeclampsia could be a reason to deliver the baby early. This may be either by induction of labor or by cesarean surgery. So whichever best alternative, your doctor will discuss this with you and will help you to make an informed decision. Okay, so one of the major disorders you could have in pregnancy is what we call placenta previa. Placenta previa is also called low-lying placenta, when the placenta is lying low. Usually the placenta should be located superiorly above the cervix. That's the placenta could be in the front or the back. It could be anterior or posterior, but normally it should not cover the cervix. It should not be a low lying one. So when a placenta is low lying, it is one of the major disorders in pregnancy, especially the one that is located near to the cervix or it is covering the cervix. So the position of your placenta is recorded at your 18th to 21st ultrasound scan. When you do your ultrasound at 18 to 21 weeks, so your sonographer or your doctor would examine the location of the placenta, and if it is significantly low, that is, if it is extremely low, you will be offered an ultrasound scan later in pregnancy, usually around 32 weeks, to recheck its position. For 9 out of 10 women, the placenta most of the time has have moved to the upper parts of the uterus by this time. But however, if the placenta is still low in the uterus, even at the recheck at 32 weeks, there could be higher chance that you could bleed during the time of birth, especially if you attempt a vaginal delivery. Why? It's because the placenta is covering or is very close to the cervix. Also, this bleeding could be very heavy and might even put you and your baby at risk. So your doctor might advise you to come into the hospital at the end of your pregnancy so that emergency treatment can be given very quickly if you are bleeding. Okay, so if the placenta is near or covering the cervix, like I said, the baby cannot get through the cervix, so the baby cannot be born vaginally if the placenta is located near the cervix or covering the cervix, either partial or completely coverage of the cervix by the placenta. The baby cannot be born through the vagina, so your doctor would offer you or will recommend a cesarean surgery. Okay, so we move to another major disorder in pregnancy. So this is what we call obstetric cholestasis or severe itching. So severe itching could be a sign of the condition I mentioned earlier, which I called obstetric cholestasis. This is just a potential dangerous liver disorder, and it seems to run in the family, although it can even occur even if there is no family history of this condition. So the main symptom of severe generalized itching without a rash, you just see that your body will just start itching you without a rash, and this commonly happens in the last 4 months of pregnancy. So this obstetric cholestasis can lead to premature birth, it could lead to stillbirth, or it could lead to serious health problems for your baby. So it could also increase the risks of maternal hemorrhage after the delivery. So when should you get up? When should you call your doctor? You should call your doctor. You should see your doctor immediately if the itching becomes severe, particularly if it affects your hands and feet. Also very important, when you discover or you observe that you are having jaundice, that is yellowing of the whites of the eye, that is sclera, or the skin. You should also see your doctor when you feel or when you're having itching and a severe rash. Okay, so that is that about obstetric cholestasis. So we'll talk about another major problems in pregnancy, is what we call slow growing babies, or when we call them small for age. Okay, or we call it IUGR, intrauterine distorted growths. Okay, so many of the tests in pregnancy will check that your baby is growing well. So if you've previously have a small baby, or if you smoke heavily, the midwives, your doctors will already be monitoring your pregnancy closely. So your blood pressure checks, we also pick up signs if there are complications. So if there's any concern about your baby's health, so your doctor might ask you to do some further tests in order to monitor your baby's growth more frequently. Okay, so when should you get up? If you notice that your baby's not moving well, if you notice you're not having adequate maternal perception of your baby's movements, you should notify your midwife and your doctor immediately, because it could be a sign that your baby in there is unwell. So normally you should keep a track of your baby's movement. Try and check how many times is your baby moving, how many times are you having fetal kicks in a day. So that will help you to know if there's any abnormality, or if there's any anything that is not normal. So it will give you the it will open your eye to it in order to discover earlier. Okay, so now we move to what we call vaginal bleeding. Vaginal bleeding is also one of the serious problems in pregnancy, and bleeding from the vagina can happen at any time. Whatever time it happens, it is a dangerous sign. So some causes of vaginal bleeding are more serious than others, so it is very important to find the cause straight away. So what are the likely causes or causes of bleeding in pregnancy, vaginal bleeding? The first likely cause of vaginal bleeding in pregnancy could be when you bleed after sex. It's just because the cell of the surface of the cervix, they often change in pregnancy and make it more likely to bleed, particularly after sex. This is what we call a cervical ectropion. So vaginal infections could also cause a small amount of vaginal bleeding. Another likely cause of bleeding in pregnancy is ectopic pregnancy. In early pregnancy, bleeding could be a sign of ectopic pregnancy or a miscarriage. Although many women who bled at this time, they still go on to have the normal and the successful pregnancies. If a pregnancy is threatening, that doesn't mean the pregnancy will not stay. With good, adequate and prompt obstetric care and intervention, the pregnancy will progress to term. Okay, but in cases of ectopic pregnancy is when the pregnancy is outside the uterus. It could be on the fallopian tube, it could be anywhere, but any pregnancy that is not being implanted, that is not embedded in the uterus, is known as ectopic pregnancy. So for ectopic pregnancy, chances are that the viability is so reduced. So your doctor might ask you to do a surgery to like evacuate the ectopic pregnancy, then offer you pre-conception counseling against your next conception. Okay, so bleeding in late pregnancy, the most common sort of bleeding in late pregnancy is just a small amount of blood that is mixed with mucus, and that is what we call show. This is just a sign that the cervix is changing and becoming ready for labor to start. So it may happen a few days before contraction starts, or even during labor itself. Okay, so anytime you feel you're having blood, or you're bleeding in pregnancy, or you're having vaginal bleeding, please always contact your doctor and your midwife. It is very important, so that they can rule out the causes of bleeding and to see if it's something not serious or detrimental to your pregnancy. So we'll move on to talk about visa previa. Visa previa is a rare condition. It occurs, let's say, 1 in 3,000 or 1 in 6,000 births. So visa previa is just when the blood vessels of the umbilical cord, they run through the membrane and they cover the cervix. Normally, when we do a vaginal examination, what should present should be the presenting parts, maybe the edge or the buttocks, whichever presenting part your baby is bringing with. Most baby presents with the edge. Some babies present with the buttocks or legs. That is in case of breech presentation. Okay, but visa previa is an abnormality. It's one of the major disorders whereby instead of any of those presenting parts I talked about to present at the cervix, it is the blood vessels or even the umbilical cord that presents. Okay, so normally these blood vessels should be protected within the umbilical cord. when the membranes rupture and the water breaks, these vessels may turn, they might even give way, causing vaginal bleeding, and the baby can lose a life-threatening amount of blood and die. So it is very difficult to diagnose, but it may occasionally be spotted even before birth by an ultrasound scan. So visa previa should be suspected if there is vaginal bleeding and the baby's heart rate changes suddenly after the rupture of the membranes. Okay, so that's why we tell you anytime you've ruptured your water, it is important that you have to present yourself in the hospital as soon as possible in order to rule out complications like visa previa and the likes. Okay, so we'll talk about deep vein thrombosis. Deep vein thrombosis is one of the serious problems that could happen in pregnancy, and it's a serious condition where clots develop. That's often in the deep veins of the leg, and this could be fatal if the clot travels from the legs to the lungs. The risk may increase if you are like on a long haul flight over 5 hours. That is for mothers that travels to on the air, and people that sit still for a very long time. So there could be risks of deep vein thrombosis whereby a clot could form in the leg and travels all through the blood to various systems like the brain, like the lungs, and this could be very fatal. So you should get up if you develop a swollen or painful legs, or you have the breathing difficulties. Okay, so you should go to your nearest hospital or an emergency department immediately if this happens to you. Okay, so that will be the end of today's class. It's a very short one where we talked about the major problems in pregnancy and what you should do anytime you feel or notice any of the symptoms. So we talked about high blood pressure, that is a pre-eclampsia or eclamptic fit, and we talked about visa previa, we talked about deep vein thrombosis, we talked about vaginal bleeding in pregnancy. Okay, so if you have any question, concerns, you want to make inquiries, you want to comment, please drop that in the chat box below, and we answer them as soon as possible. Okay, then at the delivery suite of the Reddington Hospital, even at our breast and gynae clinic, your midwives are always here for you 24 hours. Our clinic do not operate in the nights. We operate our clinic from Monday to Fridays from 8 a.m. to 5 p.m. So anything apart from this, if you are having any concern and you want to present to the hospital, you should do well to talk with your consultant obstetrician or your midwives. As a matter of fact, you should have your midwife's number, you should have their contact, even your consultants, so that you can relate to them easily on areas of interest to you. And if you're coming to the hospital after the clinic hours, you can present at the emergency department of the Reddington Multi-Specialist Hospital, where prompt and adequate intervention would be carried out immediately. And if you need to present at the delivery suite, you are always welcome. So till I come your way next time, remember to stay safe in pregnancy and stay healthy. So I remain one of the midwives working here, Messi Shittu. All right, do have a great day ahead. Bye.